Carrie Fisher passed away days after suffering a massive heart attack on a flight from London to Los Angeles. While some of the factors in her case remain unclear, of course, we know that heart disease is the leading cause of death in the U.S., taking more than 600,000 lives every year. Dr. Campbell is a cardiologist and the author of Women and Cardiovascular Disease, so you certainly know a lot about this. Let me ask you, you say it's more difficult to identify or to recognize in women. Some of the symptoms which surprised me, atypical symptoms, are nausea, back pain, flu-like illness, a feeling of dread. Tell me about that.
You know, you're exactly right. You know, men typically present with chest pain, shortness of breath, and, very classic symptoms. Women may have very atypical symptoms, such as, like you mentioned, the nausea, the back pain. And, it may get blown off by the emergency room physicians or the patient themselves as not being cardiac related. And so we see women really being undertreated and underserved.
So if you feel like you have a flu for a long period of time, you may actually have had or be having a heart attack. Is that what you're saying?
What I'm saying is you really have to interpret symptoms in the context of risk. And what I really want all our viewers who are women to understand, what are the risk factors for heart disease? Diabetes, high blood pressure, high cholesterol, family history, obesity, and tobacco smoking. If you have these risk factors and are having atypical symptoms, you really need to reach out to your physician and get screened.
What are screening tests that are appropriate? Because if you're sitting there and you're thinking, well, I have some, but not the other, but now I'm nervous, what do you do? How do you get started?
The first thing I would advise women to do is talk to their primary care doctor. Let them know what your symptoms are, understand your risk. And if you do have significant risk factors, I would probably start with a stress test where we walk you on a treadmill with an EKG and look for abnormalities. And from there, if that test is positive or equivocal, we can move into more advanced testing.
We're seeing more of this now than before. Is that right? How come?
I think what we've seen is we've really done a great job of raising awareness of heart disease in men. It's really thought to be a man's disease by the general public. We've got to do better now of treating women, because actually only about 50% of women realize that heart disease is their #1 health threat. So if we can educate and advocate and then do research for heart disease in women, we can make a difference in outcomes for women too.
People look at the case of Carrie Fisher, and obviously, we don't know a lot of details about that. And, it's still a period of time where people are so sad about her loss, and I don't want to diminish from that at all. But looking at this case, it reminds people about the risk. What are some other risks that are out there? Because she was very vocal about the fact and sharing, that she had drug abuse problems in the past, that, she was a victim of bipolar disorder, and she was open about that to try and help other people. But are those the kind of things that might create more risk?
You're exactly right. Anytime you abuse substances, it does things that are negative to our health and our body. And it also is associated with other habits, maybe binge eating and drinking too much and other things like that. And it can have a negative impact on your cardiac health. One of the things I like to think about is Princess Leia from Star Wars was a symbol of hope. And I really think that Carrie Fisher would want to be hope for millions of American women who are out there that may have the same issues that she had with mental illness and with heart disease, and maybe inspire other women to take control of their own health.
Well, I would think she would certainly want that, because she was such an advocate on the mental health front, really an inspiration. Dr. Campbell, thanks for your time today.
Thanks so much for having me, Melissa.
So for more, check out foxnews.com for Dr. Campbell's opinion piece on women and heart disease. Go to opinion.foxnews.com, go to foxnews.com, click on the opinion tab. I tweeted it. You can find it there. It's a great piece. Check it out. John.
We are getting